We'll just give a couple of minutes for anyone to join and then we'll get started. Okay, let's get kick-started, everybody. Okay, so welcome to our webinar, Easing Stress in Veterinary Practices and How Technology Can Help. I'm delighted to welcome Michelle Grattan from Vetlife today. Michelle, are you happy to give a small introduction about yourself?
My name is Michelle. I'm the Donor Relations Manager at Vetlife. So essentially my role is to talk to anyone and everyone I can within the profession, predominantly with the aim of raising as much money for Vetlife as possible to fund our services, which in turn obviously serve our beneficiaries. But it's really important for me to understand the veterinary world in every sense. So again, a huge part of my role is having conversations with vet surgeons, nurses, attending meetings, conferences, and sessions to ensure that I know what's happening in the world of veterinary in all ways, shapes and forms.
Perfect, thank you and welcome. And just a quick introduction. My name's Victoria Deemer-Smith. I'm the Director of Implementation at Vetstoria. But before this, 6 years ago, I was a veterinary nursing clinic for approximately 15 years and also become a mental health first aider, always very passionate about how we can improve our mental well-being within the industry. So really looking forward to this webinar today. So what's on the agenda? So how can we ease those stresses that we are seeing in clinic? So we're going to go through identifying those stresses, resources and support, how Vetlife can help, technology solutions, and finally, how Vetstoria can help. And before I go forward, if you do have any questions, feel free to use the chat option and we'll address those later on at the end. So our first slide here, we're exploring what the mental health challenges are in the industry today. And we've got some statistics here from numerous studies that are referenced on the screen. But it's important to mention that the veterinary profession is deeply rooted in compassion and care, but the demand on our services does take a significant toll on our personal and professional well-being. So some of those challenges that are mentioned here are stress, burnout, emotional exhaustion, and financial pressures that unfortunately do affect a lot of us in the field. So let's take a closer look at some of these studies here. So first of all, we can see that stress and student debt are a leading concern amongst veterinary professionals. And this is usually due to student debt, which often doesn't align with the lower starting salaries that we see in the industry. And this financial strain can start very early in their careers and continue to linger throughout. We then see on the left that burnout, unfortunately, is high amongst younger staff. And this is no surprise that we see this with the long hours within our practices, the emotional strain, high workloads, and veterinary professionals unfortunately lack sufficient rest and they experience burnout. In the middle, we can see that 47% of professionals do not recommend becoming a veterinarian, sadly, and that CSRs and veterinary assistants report lower well-being compared to their team members as well. So we know that team members are constantly dealing with emotional stress from treating sick animals, complex cases, and supporting pet owners through difficult decisions. And compassion fatigue is becoming more common, and we're seeing more reports of that lower well-being compared to the general population. And this, of course, leads to high levels of stress, sadness, and isolation. And then on the right, we see serious psychological stress, unfortunately, with nearly twice as high amongst staff. And unfortunately, when we see these high levels of stress, it can cause anxiety, depression, and unfortunately, higher rates of suicide compared to other occupations. And this doesn't just affect the vets, it affects the wider team, including the nurses, receptionists, practice managers, amongst other team members as well. Now, at the bottom, there is some good news. There was a Merck study done in 2023 that shows that 74% of professionals indicate that they're somewhat or extremely satisfied with their careers, but it's not 100%. So this is why we need to continue having these conversations to get those numbers up and basically addressing what stresses there are within the clinic and improving mental well-being so that professionals can, of course, increase that job satisfaction and reduce burnout as well. So if we look at identifying stressors, so we'll focus on some key psychological stresses in practices today with a particular lens on the UK, but I can imagine across many regions, this is going to be relatable to veterinary teams. And we'll go through these and we'll just dig a little bit deeper into each and every one here. But first of all, we have high workload and admin tasks. So being a veterinary nurse myself and having a lot of vets and friends still within the industry, we know that demanding schedules are still present. It's very rare for you to do 8-9 hours a day. It's usually 10, 11, 12, if not more. And of course, this impacts your weekends amongst public holidays as well. So you see long hours, high patient volumes, emergency cases, and this has only been causing more pressure, unfortunately, due to the fact that we're seeing staff shortages, so increasing pressure on existing team members to fill gaps. So considering this, it's very difficult, of course, balancing patient care, client interactions and practice operations as well. And the admin tasks involved are huge, quite a documentation overload between medical history, case notes, new client registrations, invoices, to name a few. And usually with these admin tasks, there is an element of time pressure. So they have to be done or fulfilled within a certain time. And this cuts into our patient care and personal well-being. We also see client friction and cyberbullying, unfortunately. And this, of course, can be caused due to difficult conversations, whether that's explaining complex diagnoses, euthanasia, or unfortunately not necessarily meeting the client expectations. We know that there's also disputes over fees, which can also lead to aggressive behaviour or verbal abuse. And then, of course, with the use of social media now, we are seeing an increase in negative online reviews, public criticism, which unfortunately impacts people individually and, of course, their personal and professional reputation. We've seen social media harassment where it's escalated and gone into other online communities as well. Financial debt, so as mentioned previously, we have student loans, of course, that linger well into individuals' careers. Pay disparities, so perhaps salaries not quite matching the intensity or importance of an individual's work. And unfortunately, the rising living costs, which we're experiencing across the UK at the moment, which are only going to add to that financial strain. Emotional and physical exhaustion, as mentioned before, compassion fatigue. We are constantly exposed every day as an industry to suffering and loss, and the physical toll of long hours, few breaks and demanding tasks can make it very hard to manage day to day. And then finally, workplace culture. So unfortunately, there could be some toxic dynamics amongst teams, whether that's lack of communication, micromanagement or unrealistic expectations. Sometimes we see friction between staff members, and especially in relation to sort of mental health challenges, there may be a hesitation to be open or for team members to feel safe there. Now, looking at these psychological stresses, Misha, would you say that these are in line with what you experience at Vetlife? Have we got sort of the key ones there, or are we missing any?
No, I think, yeah, they're definitely the key themes of our helpline. Just to sort of prefix that with our helpline is totally anonymous. So if you're calling the Vetlife helpline, you can give as much or as little information as you like. The only thing we record are themes of the call, and each call will likely have several themes, and these definitely cover the main ones, yes.
And just listing them out as I did, it's really overwhelming, isn't it? Just to kind of get that snapshot into clinic life and how individuals can be stressed on a personal and professional level. But it is good to start talking about these and understanding them, because then we can take meaningful steps to improving and using technology, of course, the veterinary profession here. So why is it important to address stress? So stress impacts everyone. We've all felt it, whether it's short-lived or unfortunately chronic. And it's when it becomes unmanaged that it can lead to serious consequences. And this is particularly important for the veterinary profession because we lead with compassion and precision in our roles. So addressing stress is really crucial for improving those key points that you can see on the screen here. And we'll dig a little bit deeper again into each of these. So enhancing our mental well-being. So when we effectively manage stress, it promotes mental and emotional balance, while chronic stress can lead to burnout, anxiety, and physical health issues. So we need to think about how we can, of course, improve this, adopt a supportive environment that can allow individuals to thrive. Then we have improving job satisfaction. So unchecked stress leads to dissatisfaction. But if we manage stress, we tend to feel more in control of our role, engaged and connected to our purpose, which is really important, especially in the caregiving industry. And when we feel connected to our role, this will lead to motivation and commitment. Boosting patient care quality. So when we're under stress, this can, of course, impair our judgment, decision making, whilst if we address it, it helps us focus better, communicate effectively, and ultimately we want to provide optimal care and improve outcomes both for our patients and our clients. Looking at creating a positive work environment. So we know stress can be quite harmful to teamwork and morale, but when we manage to get stress under control, it promotes collaboration and we communicate better, and it's usually a positive work culture. So if we can create that supportive environment as a team, you'll find that it usually attracts and retains talent, which is beneficial long-term for the organization as well. Reducing errors and increasing efficiency. So stress contributes to errors, especially in a high precision field like veterinary care. So when we manage stress, it improves our focus once more, reduces mistakes, and again, leads to better outcome for our patients. And finally, improving physical health. So chronic stress is intrinsically linked to physical health. It can cause issues such as high blood pressure, heart disease, or a weakened immune system. So by addressing stress, we want to support your overall health, which of course is going to make you feel better personally and enhance your performance. So it really is about prioritizing stress management in order to improve your well-being, both personally and professionally here. So on the upcoming slides, we're going to look at what resources and support could be utilised to create a safe environment. So how to promote mental health awareness in clinic, and advice from, of course, lovely Michelle at Vetlife. So promoting mental health awareness. So we're going to go through just some suggestions here that you could start exploring as individuals, as clinic teams, and where you could really start bringing about this awareness. And I would just say, just be kind to yourselves. You know, it's usually quite complex. It can take a bit of time to get these ideas shared across and implemented amongst teams. But let's have a look at what we can certainly start with here. So first of all, reducing stigma through open discussion. And this is something that I'm particularly quite passionate about in normalizing conversations. So encouraging open discussions about mental health, whether that's in meetings or informal settings. And I do feel that it's important for everybody to collaborate on this. but particularly leadership involvement. So practice leaders perhaps modeling openness by sharing their own experiences, as long as safe to do so, but also active listening, listening to your team members without judgment. You could also host mental health awareness workshops and seminars to destigmatize seeking help. So by doing these things, we want to create an environment where employees feel safe to discuss challenges, again, without that fear or judgment. And then next, we have fostering a healthy workplace culture. So we want to respect and support our team members. We want to have a blame-free approach to when we make mistakes. And again, one thing that I'm very passionate about, and I'm sure Michelle is as well, is perhaps considering mental health first aiders amongst teams. Whether they're first aiders, ambassadors, or perhaps you want to start a peer support group where you can share ideas and offer supportive resources. I think this is just as important as having a physical health first aider on site. And again, this will help build that inclusive, positive culture. And next we can see promoting health insurance or assistant programs. So perhaps you could explore comprehensive coverage that offers insurance plans that include mental health support. Employee assistant programs may be able to provide access to confidential counselling, financial advice, and wellness resources. And again, this perhaps can offer your employees affordable professional help when needed. Next, we have work-life balance. So we want to encourage this not only for ourselves, but the wider team, whether that's flexible scheduling, allowing part-time work or job sharing, perhaps adjusting hours to reduce stress. What I'm certainly was guilty of when I was in clinic is never taking a break. So perhaps making them mandatory so that staff take regular breaks, avoid excessive overtime, excuse me, and then boundary setting as well. Again, I think a lot of veterinary professionals struggle with boundaries. They take work home with them. They perhaps will be answering emails or calls. So encouraging them to disconnect because ultimately we want to prevent burnout and help staff members maintain emotional and physical energy. And then social life. So again, we want to encourage socializing and connection, whether that's through team building activities, perhaps a regular coffee morning or team lunch. I think it's important to create peer support groups once more where we can share experiences and solutions with one another. And one thing that I particularly like amongst teams is when we celebrate each other, whether that's a milestone, achievement, or showing gratitude. Not only does this strengthen our relationships with one another, but it reduces isolation, reduces loneliness, and fosters a sense of belonging. So by looking at some of these suggestions, we're trying to prioritise mental health so that, again, professionals can thrive. And Michelle, are you happy to go over the partnering with experts part?
So I can definitely speak to I guess we've talked about it briefly in terms of work-life balance. Something that we promote at Vetlife is any kind of physical or mindful activity to support you from a wellness perspective. So one of our initiatives is Active October, where we encourage people to go out and do some kind of physical exercise or challenge. And we do this because we're certain from research and study that doing something that is challenging, or it could be something that's mindful as well, will support you in a professional capacity. I'd say sort of equally in the sense of general health, it's extremely important to take care of yourself, but there isn't a one size fits all. We know that everybody responds really differently to supporting their health and having their health supported in the workplace as well. So I'd say, like, one of the things that stood out to me when you were talking, Victoria, is that it's really important that we all understand each other in the workplace, because there isn't a one size fits all. So for some people, taking a break might be really important. For other people, it might be more stressful. So it's really key to understand each other and be able to support each other in the way that's going to work best for that person.
Absolutely, I agree wholeheartedly, and I think just having those conversations and sharing those ideas, isn't it? And allowing people to have that voice to say what works for them and what doesn't is a good starting point. Absolutely, Michelle. So thank you for that. So let's hop to the next slide here. So Vetlife, everything lovely about Vetlife, Michelle. And if you want me to hop to the next slide, just instruct me to do so.
So thank you. Yeah, we have three services at Vetlife. The most well-known service that we offer is our helpline. So our helpline, we're so proud of our helpline because it's open every day for one. So the helpline never closes. It's open on Christmas Day. It's open throughout the night. Whenever you need to call us, we will be there for you. The other thing that I can assure you of is, I've mentioned it once, I'll mention it again, total anonymity. We won't ask for your name unless you want to give it. It's a completely confidential and anonymous helpline. It's also really exciting, and we're so proud to be able to say that when you call the Vetlife helpline, the person on the other end of the phone will be somebody within your profession. So it won't necessarily be a practicing vet surgeon or nurse, but quite likely will be, to be honest. So the person that answers the phone will really understand the veterinary world, the stresses and pressures and very specific nature of working within the veterinary workplace and what that means and the pressures that that can bring. So our second service is our health support. You will be referred to health support through the Vetlife helpline. And that is there for if we think there's additional care that's needed once that call is finished. And then our third branch of our services is our financial support. Just to be clear, our helpline is open to anybody in the veterinary community. So that can be as broad an interpretation as you like. So you can be clinical, non-clinical, receptionists working for a supplier, a pharmaceutical. We're here for everyone in our community. Financial support and health support is open to registered veterinary surgeons and nurses. Thank you.
Thank you, Michelle. Excellent. So we've also got some veterinary resources here as well. Would you like to explain those?
Yeah, so on our website, which I would highly recommend you have a really quick look at, even if you've just got a couple of minutes, our website is actually very simple and very user-friendly. And within the website, we have a section called Advice and Information. And within that section, you'll see lots of different little subheadings. And essentially what you'll find are tools and resources to support you based on whatever the situation is that you're potentially going through at that time. So you might not feel like you want to call the helpline, but you might just want to do some reading, some research. So have a look on the advice and information section. You'll find lots of resources and information there. And our most recent, I'll just highlight one, our most recent resource is our neurodiversity resource, which you can download or you can actually order a copy of as well. And it won an award actually very recently for Campaign of the Year. And we're really proud of it because it gives you, and this is what I think is really important for you to know, it gives you some really, really clear ways forward. So it's not just open to your interpretation. I think sometimes we get put off when we're trying to look at ways of support and ways of help because it's quite generic and general, and we really have to fish through a lot of information, and it's hard, you know, when you're having a difficult time. That's a really hard thing to do. So our resources are sort of very, very clear and concise, and especially with the neurodiversity resource, it will give you some very specific things to action and to look at and to be able to do to support yourself and your colleagues.
And I echo that, Michelle. I read your neurodiversity
Great.
brochure, and I thought it was fantastic and very relatable. I know there was some sort of key case studies as well that I dived into. So yeah, it was fantastic. So keep up the good work, is what I would say.
Thank you.
Excellent. So we'll move on to Our next slide. So alleviating pressure. So looking at some technology solutions. So as Michelle's quite rightly said, it's complex for every individual, the stresses that they face and how they manage them. And we're offering some suggestions here and signposting you to some solutions potentially. And technology certainly may be a way to alleviate some of those stresses. So we're going to look at how we can reduce phone calls, automate routine admin tasks, digitizing client information, improving client communication and setting team and client expectations as well. So how can we support you using technology here? So let's have a look at these. So how do we leverage technology with regards to reducing phone calls? So let's start with this one, because I think this is a major source of distraction for many veterinary practices, especially since the pandemic, as call volumes are on the increase. And usually these phone calls can, of course, equate to booking appointments, answering routine questions, and it can certainly interrupt your workflow and drain you from essential tasks. And what really matters is we want to give you back a little bit of time so that you, of course, can focus on your well-being and that of your patients as well. So reducing phone calls, there are solutions out there, such as online booking systems that allow clients to schedule appointments on their own. Perhaps there are features such as chat as well that can allow clients to reach out and ask questions at their leisure. But you can also have automated reminder systems that can send texts or emails for client appointment confirmations, vaccine reminders and follow-up. So it frees up the reception staff time, but also allows a better experience for the pet owner as well. And if we look at automating admin work, so we know from experience there are numerous repetitive tasks in clinic, whether that's filing records, sending invoices, processing payments. They're incredibly time consuming. And usually they're all happening at once at that front desk, and it can be quite chaotic and a high pressurized environment. So by adopting things like practice management software, that includes automated features, you can save significant time, whether that's patient records being automatically updated after each visit, invoices automatically sent to clients where they can make payments themselves. What we want to do is reduce that manual intervention. And with automation, you can reduce human error, and it again allows you to focus on patient care rather than those administrative burdens. You may have seen at London Vet Show as well, while it comes to mind, there were a lot of technology solutions regarding sort of AI-powered solutions that may help you sort of answer questions diagnostically or save times, giving clients sort of a chatbot and powered answers to routine or frequently asked questions as well. So that's food for thought. And then digitizing client information. So we've relied heavily in the past on paper records, but as the demand for efficient care rises, we need to move to digital systems. And this benefits everybody because we have access to patient histories, test results, and medical treatments at the click of a button. It also reduces the risk of miscommunication because we're able as team members to have access to real-time information. And also clients can access pets records, and this usually leads to enhanced engagement, and they can, of course, adhere to treatment plans a bit better as well. So it's all about making it accessible and more efficient, both for our teams and for our clients. And then improving client communication. So this is really vital to our role and is usually an area which brings a bit of pressure, and it can also be quite challenging within veterinary care. But if we use tools such as client portals, apps, we can enable pet owners to communicate with us directly, whether they have a routine question about their pet's condition, need to reschedule an appointment, or check on lab results. So again, this enhances client satisfaction, but improves the flow of communication amongst clinic teams so you can focus on direct patient care. Setting client expectations is really important as well. So by managing pressure, we can improve client satisfaction. So using technology to perhaps set expectations at what they can expect at every stage of their visit. So this could be from outlining sort of pre-appointment instructions to post-visit care details, automated communication, upfront payments, and we can do a lot here, as well as add things like frequently asked questions, videos or instructional items, again, just reducing the need for back and forth communication with your clients. Now, all of these elements are really great, of course, for how we operate as a team internally, improving client satisfaction, but it really is important to set team expectations as well. Because when we use technology, it does create a structured environment where we know what we are responsible for. So tools such as staff scheduling software, that means shifts are well managed, can certainly support us day to day, and where we can assign tasks that are delegated without confusion. We're also seeing a rise in teams using communication apps internally. So you can stay in sync with one another regarding assignments, updates, or reminders. So everybody's on the same page. We're working as a cohesive team, and it reduces pressure amongst staff. So integrating technology, not only can it reduce phone calls, automate routine tasks, and improve communication amongst our clients and team, it helps ease that workload stress so that we're more efficient and our clients are satisfied as well. So how can Vetstoria help here? So we'll briefly go over what we can do to offer those I suppose, ways of alleviating pressure and relieving those stresses for you. So we can do automated appointment scheduling. So clients can make bookings online 24/7, which means when you're closed, perhaps they could go online out of hours and book in directly to your practice management system. And this is real-time availability. So we take into account whether you're closed, whether you've already got meetings booked, etc. And we're taking into consideration your internal operations. And we can also support you with new client registrations as well. It does reduce phone calls, as mentioned. You'll have less inbound calls as your clients can book online with ease, or perhaps use a chat feature as well. Improved client communication. So we offer automated reminders, again, Vetstoria chat. And one thing that's very popular amongst the nurses at Vetstoria are the content packs. So these are digital educational materials. We've come a long way from the notice board in the waiting room, but you can offer, educational material throughout the year that you may be campaigning. You could be shouting about your services. And again, just improving that client communication and setting expectations. Once more, digitizing client information, so seamless data integration with your practice management software. And we want to manage client expectations. So a lot of people nowadays will expect to be able to book online, for example. So we want to be accessible to your clients. And we also want to set expectations by using disclaimers. So they could be pre-appointment instructions, so they know exactly what to expect when they arrive to you. But ultimately, finally here, we want to save you time. We want to reduce those admin burdens and optimize staff scheduling so that you can reduce those stresses that you experience in clinic. Excellent. So as we draw to a close, we are, of course, allowing you to bring up any questions that you perhaps would like Michelle or I to answer. So we'll give a couple of minutes here just in case anyone has anything pressing. While we wait, just in case anybody brings up anything, I'll just skip to the next slide because this is important, Michelle, because it highlights the wonderful resources at Vetlife here. So we have your website, as you mentioned, is really quite easy to use and navigate around, isn't it? As well as your email and helpline here. So I'll just leave that on the screen while we wait.
Great, thank you. And yeah, I'd encourage you to put the helpline number in your phone as well. While it's here, you may not need it, but you may come across a colleague who is in need of support. So if you have that number handy, then it could make a real difference to someone else that might need to get in touch.
That's a really good point, actually. And also having it ready. I'm part of many social media veterinary groups, and I usually signpost people to the website, but I'll take a screenshot of this and perhaps I can share it
Great.
further afield as well. That's a good
Thank
idea.
you.
Excellent. So I don't think there's any questions. So before we close today's webinar, Michelle, do you have any final words at all?
Just as I said, please encourage people to use our services. I'd say the thing that I hear most from veterinary professionals, mainly clinical actually, is we don't want to bother you. My problems aren't big enough to come to Vetlife with. We're not just here as a sort of crisis service or a last point of reaching out. We're here if it's just been perhaps a tough day. We'd rather have 100 phone calls from people that have had one bad day than one phone call from somebody that's had 100 bad days. So yeah, we're here for you. Yeah, please use us.
Thank you, Michelle. Very well said as well. And I agree. We need to continue the discussion. We need to keep talking about mental health and well-being so that we can have a more sustainable veterinary profession. And absolutely, please, everybody that's listening, head over to Vetlife, access the resources and support so that we can really start allowing individuals to start feeling safe and supported when facing those challenges. And start asking questions about how technology perhaps can alleviate some of the pressures you face, whether that's automating routine tasks, streamlining communication. We want to be able to help you focus better within your roles, not only for your personal well-being, but of course professionally as well. So thank you, Michelle, for joining me today, and thank you everyone for being part of this conversation. I suppose until
Thank
next
you for
time.
having me. Thank you so much for
You're
having me.
most
Lovely to
welcome.
see you all.
You're
Bye.
most welcome, Michelle. Thank you, everybody.